The Careful Devices Project initiative truly seems like it's going to change the way that patients interact with their health when it's not just that patient physician relationship. Um, when they can do it in the comfort of their own home and just having their own judgment and personal experiences to interpret the way that they're feeling or the way that these devices are giving the data to them for them to interpret. The way that the manifesto was written and how these careful devices are being created, I thought was really great because it sets a standard of how these careful devices should be interacted with and how people should experience these sort of devices. Um, the Ovum device I thought was really amazing and changes the way that people view that sort of topic of fertility tracking and trying to get pregnant. One device I think would be really amazing to see are devices for people with diabetes, since people with diabetes have this constant tracking that they have to do with their blood. I think it would be really amazing to see some sort of device made for them to make that whole process that they have to go through every day a little less painful.
We have learned in this class that gathering health information is very beneficial for patients to be updated about their personal health, but also helpful for researchers who are coming up with new discoveries and treatments. In this week's article, the National Institutes of Health Research Program, All of Us, has made significant advances in precision medicine. Through the data gathered by more than 230,000 volunteers, All of Us is able to create a robust data platform to support a wide range of health studies. Volunteers contribute to the research program through various ways, such as surveys, EHRs, physical measurements like blood, urine, and saliva samples, and Fitbit devices. 80% are from groups that have been historically underrepresented in biomedical research, but through this research, they are able to have a better understanding of diverse populations.
Hi, I will share information I discovered at Alpha's research program website. The program has a slogan, "The future of health begins with you." It reveals the purpose of the program to advance precision medicine based on individual situation. It considers factors like where you live, what you do, and your family health history to find the best treatment for patients to stay healthy. The steps of the process are the participants share data online, data is protected, researchers study the data, and participants then get information to learn more about their health. And at last, researchers share discoveries that work better for different people. The program is not far from us. All eligible adults over 18 living anywhere in the United States can be part of the program and get involved in the future of health.
One of the questions we ask ourselves is, we're all different kinds of people. For example, some people are healthier than other people, some people are younger than other people, some people are older than other people. The question is, even though all of us have different characteristics, when we go to see a doctor, they diagnose us all the same. So why is that? The reason for this is because we don't have enough information, and that's where All of Us comes in. Basically, All of Us is a research program that is asking for people to participate in it, because the more data it can collect, the easier it is to keep track of that data and to use that data to help us in the future.
The All of Us research program asked those in the United States to join for a good cause for the sake of science and well-being. Director Francis Collins explains that in this study, electronic health records will be disclosed with consent, and participants could utilize wearable devices to keep track of certain measurements. The purpose of this research program is to progress with managing chronic illnesses, and this is done by collecting and analyzing data from different types of people with different types of lifestyles. The director also claims that they are aiming to have half of the participants from rural communities or the underrepresented people. My question for the National Institute of Health is how this will be done if those who are in lower SES may not have access to wearable devices, access to the internet, and access to care centers that are required for follow-ups.